Bismillahirrahmanirrahim. Assalamualaikum and good evening everyone. Now we go to our next topic is exercise prescription for special population according to SASM 2000. So in this topic we will discuss four different population. Number one is children, number two is elderly, number three is pregnant women, and the last one we will discuss about exercise prescription for obese people. Okay, we start with exercise prescription for children. According to SSM 2000, there are several benefits that you can gain for physical activity for children. Number one is greater strength and endurance. Number two, enhanced bone formation. Number three is weight management. Number four is reduce anxiety and stress. Next is improve self-esteem and self-efficacy. Your child will become more confident. Next is minimize the heart disease risk factor, fun and enjoyment, social interaction with their friend, bermain bersama-sama, and the last one is increase their skill. Here are exercise prescription for children. Person or child more than 6 years, at least 30 minutes of moderate intensity physical activity on most and preferable all day of the week. Number two is young children, active play, enjoyment, and have creative activity. Next is children does not need heart rate prescription to regulate intensity. Maksudnya awak tak perlu macam kita ada training heart rate zone, tapi for children tak perlu benda tu. Kenapa? Sebab jantung dia memang berdegup laju. Kalau awak ikut dia tu, sebab budak-budak lagi kan, dia memang masih aktif, masih cergas. The heart also in a very good condition. And the last one is variety of exercise. What you can do is weight bearing activity, basic skill development, weight management, aerobic fitness, and bone mineral content. Next is general guidelines, resistant training program for children. Number one, it should be supervised and monitored by trained staff staff yang berkelayakan. Number two is physiological immature participation. Number three is primary focus is learning proper technique and develop interest. Maksud dari sini adalah focus on their technique dengan teknik dia dan bukan the result. Tak semestinya mesti lari laju. Tak, lari dengan betul tu yang paling penting. Pergerakan yang betul. Next is control movement. Tak ada biar macam tu je. Next is avoid practice powerlifting and bodybuilding. Of course, no weightlifting. And next is full ROM, multi-joint exercise, involve more than one joint. And the last one is ensure participant can understand and follow instruction. Next slide is dose response for resistance training. The intensity is avoid reps use of maximum load until reaching adolescent. Selagi dia budak, jangan bagi maximum load. Weight load should be more than 8 reps and don't perform to the point of severe muscle fatigue. Budak-budak jangan awak bagi training macam kita punya training. And the last one is increase number of reps first and then increase number of the load. Ni hampir samalah dengan kita. Increase rep first and then increase load. Jangan nak increase load dahulu. Increase rep dulu. Increase rep and then increase load. The duration is 1 to 2 set of 8 to 10 exercise within 8 to 12 reps. At early stage, 1 set. Rest 1 to 2 minutes between exercise. Berbeza dengan kita, kalau kita endurance less than 30 second kan, tapi dia mesti 1 minute to 2 minutes between exercise. Kenapa? Sebab budak-budak dia tak tahu erti penat lagi. Janji dia suka benda tu, dia akan buat saja kalau dia suka benda tu. And the last one is interspace rest day. Ada rest untuk setiap consecutive day. Hari ni training, esok rest, lusa training, tu rest lagi. Tak ada istilah training hari-hari. And the frequency should be 2 times per week only. Next slide is physical activity for preschooler. Okay, dance and rhythmic activities. Safety precaution. Number one is you should go for proper warm up and cool down. Next is allow the intermittent rest period within the class activity. So there are the rest. Avoid movement that result in hyperextend of any joint. For point number 3 ni, ingat lah, joint budak-budak dia masih fleksibel. Memang dia akan dapat buat benda tu dan tak rasa sakit. Sebab tu, we need to avoid movement that result of hyperextension. Next is do not repeat a movement more than 4 consecutive times on one leg. Next is avoid any quick jerky movement of the arm, head or leg. Next is be caution of dance move that use a crossover step yang bersilang tu sebab the skills masih kurang lagi. Kadang-kadang dia tak boleh buat benda tu dan kadang-kadang tersilap dia buat. Bila silap boleh menyebabkan injury. Next is participant must maintain proper posture and body alignment. Topik sebelum ni tadi. And next is initially teach a dance at a slow tempo without music. Ajar dulu dia. And then gradually moving from simple to advanced movement. And the last one is proper attire. No jewelry, wear general cross-training sneakers instead of running shoes and socks. Maksud dia kasut indoor. Pakai kasut indoor untuk for dance and rhythmic activity. Next slide, here are some motivational strategy when you go for children physical activity. Number one is teach basic skills. For example, how to jog, curl up, proper form and technique. Participant assume you care about improving their physical development. Maksud dia fokus dengan teknik dahulu, bukannya performance. That is for children. Number two is choose success-oriented activity, design activity at the appropriate development level that include challenge that participant can achieve through practice. Sebab, for example, activity choice is such regular push-up, open stand push-up or wall push-up. Maksud dia di sini adalah budak-budak dia suka berlumba tau. Kalau pasal dia suka bersaing sama kawan-kawan. So, cara dia adalah you go for wall push-up dulu. Contoh, wall push-up, dia lebih senang. At least you know, balik kepada point number one, you know you can teach them the basic skills. And then you go for regular push-up, ordinary push-up. Waktu tu, baru you let diorang bersaing siapa yang dapat buat, siapa yang tak dapat buat. Sebab budak-budak suka kan ikut kawan, bersaing, benda macam tu. Okay. And then the last one in this slide is have fun, fun, fun. Participants should laugh, sing, play and interact while engaged in physical activity. Ya, budak-budak suka bermain. They like to having fun. So, your activity must be fun. Tak ada yang stress-stress. Tak ada awak bagi dia planking sampai 5 minit, sampai muka masam. Tak. Bagi skop masa dia. Okay, do it for 10 second, 5 second, macam tu saja. Next slide is, bila kita cakap pasal fun tadi, you must add creative equipment. For example, add unusual items such as rubberized exercise toner, heavy jump rope or heart rate monitor to renew interest. Sebab budak-budak ni dia macam kucing. Kucing dia ingin tahu dia tinggi. Bila ingin tahu dia tinggi, dia akan involve in those activity. And next is create colorful environment. Decorate the gym with colorful poster, exercise chart, and bulletin board. Next is provide incentive or occasionally provide participant with positive, healthy incentive. For example, fitness certificates, yogurt for active participant. Maksud dia sini adalah healthy incentive. Bukannya, okay, siapa dapat buat, saya bagi gula-gula. Tak, tu tak healthy. Sebab tu dia bagi contoh sini, yogurt. And the last one for this slide is be a role model. You need to keep trim exercise with your classes. Sama-sama eat healthy with them. eat healthy food, keep nutrition snacks at your desk. Tengok, dia cakap kita makan benda tu, tapi your snacks, sembunyikan daripada dia. Kalau tak, dia akan bandingkan kenapa dia boleh, kenapa saya tak boleh. Sebab tu, you must be a good role model and talk to your participant about after-school activities such as volleyball, baseball, soccer, and etc. Okay, next slide is accentuate the positive. Practice using the gesture. For example, laugh, smile, give thumb up, give high five. For example, uh, dia dapat buat, okay, good. Buat macam ni, good. Yes, kamu ketawa. Dia salah buat pun ketawa juga, laugh. Smile. Tak ada istilah awak nak marah-marah, nak stress-stresskan dia. And word of encouragement. For example, great job. I am impressed. Wonderful. Etc. Tu budak-budak. Tak ada awak nak maki hamun dia. And next is involve their parents. Student will gain additional support and reinforcement when they know their parents are interested and involved with physical activity. Sebab the first role model for children adalah their parents. Dia akan ikut apa parents dia buat. Kalau parents dia tak exercise, dia pun ada potensi untuk tak exercise juga. Kalau parents dia suka makan junk food, dia pun akan ikut juga makan junk food. Kalau healthy habit juga yang children akan ikut. And the last one is vary your teaching strategy. Use a variety of teaching strategies such as small groups, independent activity, and partner workout to meet the participant need and interest. Kadang-kadang awak bagi dia partner, kadang-kadang seorang-seorang, kadang-kadang group dalam 5 orang macam tu. Baru dia happy sebab budak-budak dia suka fun, something yang baru. Baru dia ingin tahu. Next slide is exercise prescription for elderly. Next is benefit of resistance training or exercise for elderly. You can refer to resistance training program notes yang sebelum ni. Dia sama, maknanya benefit dia samalah dengan elderly dan juga for resistance training. ACSM physical activity guideline for older adult is 65 and older. Point number 1 is moderate intensity aerobics 30 minutes per day, 5 days per week, or vigorous intensity aerobics 20 minutes per day, 3 times per week. And next point is do 8 to 10 strength training exercise, 10 to 15 reps, 2 to 3 times per week. And for older adults who are at risk of falling, perform balance exercise. And the last one is have a physical activity plan. Next is exercise during pregnancy and lactation, maksudnya kepada pregnant woman. According to ACSM 2005, contrary to advice in year gone by, exercise now encouraged during pregnancy. Dulu tak boleh terus, tapi sekarang dah dibenarkan untuk buat exercise for pregnant woman sebab banyak kelebihan dia. Dan my advice is when we go for pregnant woman, we train pregnant woman at the first trimester. Pregnant woman ada 3 trimester, trimester 1, trimester 2 and trimester 3. Trimester 1 3 bulan pertama, trimester 2 3 to 6 month, and the last trimester is 6 month to 9 month. So the first trimester jangan buat any physical activity dulu sebab waktu tu kandungan dia belum kuat lagi. Tapi bila dah sampai after first trimester, starting from second trimester, baru kamu buat physical activity. Next slide is contraindication for exercising during pregnancy. Number 1 is pregnancy-induced hypertension, preterm rupture of the membrane. Next is preterm labor during the prior or current pregnancy. Next is incompetence cervix. Next is persistent bleeding in the second to third trimester. And the last one is intrauterine growth retardation. Next is benefit exercise for pregnant Woman is number one is improve aerobic and muscular fitness. Number two is facilitation of recovery for labor. Next is enhance maternal psychological well-being. Next is establish of permanent healthy lifestyle habit. Next is more rapid return to pregnancy weight, strength and flexibility level. Next is fewer obstetric intervention, and the last one is shorter active phase of labor and less pain. Next is less weight gain. Next is improved digestion and reduced constipation. Next is greater energy reserve. Next, reduce postpartum belly. Next one, reduce back pain during pregnancy. Next one is improvement in sleep, easier for you to go to sleep. And next is fewer obstetric intervention. Next is less chance of miscarriage, keguguran. And the last one is fit mom, brainier baby. Maksud dia kalau ibu dia lebih fit, anak dia pun akan ikut fit juga. So, next slide is American College of Obstetrician and Gynecologists ACOG recommendation for exercise in pregnancy and postpartum. Point number one is mild moderate exercise routine. Training heart rate should be less than 140 bpm beat per minute. Number two is start exercise only after the first trimester. Ni yang saya cakap tadi ya. Start exercise only after the first trimester. First trimester jangan awak bagi dia training dulu. After first trimester baru dia start do physical training. Next is gradually reduce intensity, duration and frequency during second and third trimester. Nampak tak beza dia dengan training biasa? Ni dia reduce the intensity on the second and the third. Bukannya increase tapi reduce the intensity. Next is avoid exercise in supine position, reduce low blood supply to the uterus. Next is avoid prolonged period of motionless standing. And the last one is avoid exercise to exhaustion. Next slide is avoid mild abdominal trauma. For example, sit up and crunches. Boleh buat sit up, boleh buat crunches, tapi jangan terlebih sangat. Next is avoid overstress joint laxity. Next is mass argument, heat dissipation, adequate hydration, cloth environment. Second last point is post-pregnancy exercise can start after 4 to 6 weeks of childbirth. Maksud dia lepas dia melahirkan selama 4 ke 6 minggu baru dia boleh start exercise for the post-pregnancy exercise. And the last one is ensure adequate diet. Additional 300 kilocalorie per day. Kalau dalam mesin apa tu? Tanita tu kita buat kilokalori dia letak sana 1600 ke macam tu. Jadi kena tambah lagi 1600 jadi 1900. Additional 300 calorie. Next slide is reason to discontinue to exercise. Apa sebab berhenti daripada exercise for pregnant woman? Number one is any sign of bloody discharge from the vagina. Next is any gush of fluid from vagina. Next is sudden swelling on the ankle, hand or face. Sudden swelling maksud dia sudden swelling, bukannya current swelling. Sebab kalau perempuan yang mengandung ni, wanita mengandung ni, dia memang akan ada swelling. Tapi tiba-tiba lepas tengah buat exercise tu ada swelling, that is sudden swelling. Tapi kalau swelling memang sedia ada tu tak apalah. Next is persistent severe headache and or visual disturbance. Next is swelling, pain and redness in the calf of one leg. Next is elevation of heart rate or blood pressure after exercise. Next is exercise, excessive fatigue, palpitation, chest pain. Next is unexplained abdominal pain, and the last one is insufficient weight gain, less than 1 kilogram per month. Exercise program for pregnant women. First point, pregnant women should be instructed to begin exercise at low intensity and gradually increase time and intensity to avoid overuse injury. Next is starting with 15 minutes of continuous activity, 3 days per week, and gradually increase to 30 minutes 4 days per week is recommended. Next point is swimming or pool-based aerobic exercise, easiest to do, but walking, yoga for pregnancy, stationary biking, and other low-impact aerobic machine may also be well tolerated. Maksud dari sini adalah exercise yang reduce the risk of falling. Semua exercise yang reduce risk of falling, tak ada naik turun tangga ke apa, tak payah buat benda tu. Step up test ke, step up training ke, tak perlu buat tu. Buat yang stationary, yang selamat for pregnant woman. And the last one is exercise prescription for obese population. Okay, when we talk about exercise prescription for obese population, of course, the program objective is to reduce their weight. So, exercise component of a weight loss program should promote a high total calorie expenditure, which is 300 to 500 kilocalorie per day and 1000 to 2000 kilocalorie per week. Criteria of an appropriate weight loss program. Number one is well-trained qualified staff. Next is your client should receive a medical screening. Takut dia ada high blood pressure ke, ada masalah back pain ke. Biasanya yang obes ni akan ada masalah satu-satu tu. Heart disease ke, benda tu. Next is a reasonable weight goal should be established, which is 0.5 to 1 kilogram per week. Tak ada istilah within 1 week naik turun 2 kilo. Tak, tu tak makan terus tu kalau turun 2 kilo. Maksud dia 500 gram to 1 kilo per week. Lagi baik 500 gram. Cukup 500 gram seminggu. Turun perlahan-lahan. Next is individualized treatment based on weight loss goal. The program should disclose in writing all health risks and benefits associated with the program, and the diet program should be contain no less than 1000 to 1500 calories per day, in between 10 to 30% fat, has at least carbs 100 gram per day. Nampak tak? Have at least carb 100 gram per day. Maksud dia, when we go for diet, kita pergi diet, tak bermaksud kita cut carbs 100%. Tapi kena juga ambil carb. Sebab kalau awak tak ambil carbs, dia akan mengganggu your metabolic rate. Next point is the program should have exercise, nutrition education component that stress permanent lifestyle changes. Permanent lifestyle changes. Maksud dia bukan waktu tu je dia nak turunkan berat badan, dia nak berdiet, tapi selama-lamanya dia akan maintain those lifestyle. Next is component of exercise should include both aerobic and resistance training. Tak ada istilah just do aerobic saja, jogging saja, berbasikal saja, do endurance saja. Tak. Dia tetap juga buat resistance training. Next is individualized behavior modification technique. And the last one is the program should include weight maintenance phase. Next slide is dose response for obese people. The frequency should be 5 times per week or daily sebab dia low intensity ya. Sebab tu you can do it daily. The duration is 40 to 60 minutes or 2 session per day of 20 to 30 minutes. Maknanya pagi buat, petang training lagi dalam satu hari yang sama. Dia pecahkan kepada dua. And the last one is the intensity is 40 to 50% to 85% of heart rate reserve. The lower level of intensity is for individual who is quite unfit. And the last one is increased duration rather than intensity. Sama juga tambah duration daripada awak tambahkan intensity dia. sebab dia tak fit, unfit. Maximum weight loss of 1 kg per week. Nampak tak dia letak sini? 1 kilo seminggu. Kalau lebih 1 kilo tu, something wrong lah tu. Adalah benda yang silap awak buat tu. So, ada makan tak cukup ke? So, ada training excessive ke? Air kurang ke? Paling bahaya kepada obese people ni, jangan sampai dia hilang berat sedangkan dia sebenarnya hilang air sahaja. Bukannya betul-betul burn their fat, yang betul-betul kurus, tapi hanya hilang air. Tu yang bahaya dia. Bila dia hilang air, dia akan dehydration dan ada lagi risk factor dia yang lain pula yang akan datang. And for our last slide is the mode, which is the type of exercise is use low impact activity, for example walking, jogging and cycling, dan termasuk juga swimming kalau dia mau swimming. Next is resistance training. For resistance training, it should be low load, high reps, focus on muscular endurance, and you also can do circuit training. Circuit training ni maksud dia bukannya high intensity ya. Low intensity of circuit training. Macam yang selalu kita tengok dekat belakang fakulti tu. Dia buat circuit, dia pusing. Macam tu. Yang just low rep. Low intensity. Precaution. Increased risk of orthopedic injury, cardiovascular disease and hyperthermia. Equipment and exercise modification may be necessary. Kadang-kadang dia tak fit dengan orang tu, tak sesuai dengan dia sebab badan dia besar sangat ke apa, tak boleh pakai benda tu. Jadi you can modify those equipment. And the last point here is resistance training exercise selection. Number 1 is modified push-up. Next is modified chin-up. Next is modified push-up ni macam push-up perempuan lah. That is modified push-up. Next is modified chin-up. Modified chin-up ni adalah dia bergantung tapi kaki dia masih kat bawah tu. That is modified chin-up. Next is ball squat. Dia squat pakai ball. And the last one is half lunges. Dia tak buat full lunges. Okay, I think that's all for this topic. And for obese people, yang paling penting adalah you do not push them to do those exercise. Bagi setakat dia mampu. At a low intensity. That is for obese people. Itu yang paling penting. Sebab masalah dia adalah bila you push they to do those exercise, satu, injured. Itu yang paling bahaya lah. Dia boleh injured. Number 2, dia menyesal pergi training. Esok dah tak nak datang dah. Sakit badan 1 minggu tak nak datang dah. So, keep it low pace dahulu. Dan cakap dengan dia, kalau minggu ni just turun 300 gram, it's okay. Minggu depan turun 500 gram lagi, it's okay. Sebab dia turun sikit-sikit tu, cuba awak bayangkan, kalau 500 gram seminggu, tak nampak sangat kan? Dalam sebulan dia akan turun berapa? 2 kilo. Ambillah 300 gram. Dalam sebulan dia akan turun 1 kilo 2, 1.2 kg. So it's a good achievement for them. Dan tak perlu nak push sangat dia buat training tu. Yang awak kena perlu push kepada klien yang obese ni adalah diet intake, food intake. Benda tu awak kena push dia. Cakap dengan dia, what is the best diet when you want to go for diet. Okay, I think that's all for this topic. Thank you for listening. See you when I see you.